But one thing I know about you is that you love learning. Because we had this conversation before the camera started rolling. So as long as I'm learning, everything's worthwhile. The reason I want to meet you today was that there's a business side to every clinic owner or chain of clinics, and you've been very successful. Tell me about why are most doctors not business people?
See, throughout our medical career, we are just taught about our subject, science. It's nothing but science. Every single day, right from the morning till the evening, and even when we get back home, we're just learning about science. So absolutely no exposure to how to communicate with people, how to make sure that it becomes an enterprise or it becomes a business, how to market yourself, promote, absolutely no clue whatsoever about that.
How was the expansion internationally different to expanding from one clinic to 3, 4, 5 in the same street and then around Dubai and then internationally? Tell us about that growth.
It's always easy to expand the business where you are physically living. You know, that's always the easy part. The difficult part is to remotely control a business, you know, and that is challenging and still challenging to me. But I adopted the same principle. When I started in Delhi, I started acquiring and making a team. And the whole focus was to build the team. And I used to tell them, don't worry about the work. Work will come. We need to focus on doing the right thing. So I did a lot of training. I got the team together and trained them what to do and how to do it. And it slowly started building up to the point that I didn't have to be directly involved in that. Same thing is happening in Bahrain now. When I go there, I meet people. Whoever is trying to help me, I just try to include them in my team. And I start training them and teaching them. So it starts functioning on its own.
So what you find, if you're actually doing a great job, the business will automatically come in.
It'll automatically come, yeah. You need to have the same system adopted there. And I tell the team not to focus on the business part. Focus on doing the right thing. And the business automatically flows in.
What's your biggest marketing? I guess referrals.
Referrals, of course, at this point is the biggest marketing. I've operated maybe 10s and 15s of people in the family. So just the blind trust.
Amazing. When I come to your clinics, the energy in the place is amazing. It's just like all family. And many of your staff have been there since day one.
Yeah.
So how did you find them in the first place?
In the beginning, of course, it wasn't advertising. I didn't have to spend to get people. Obviously, there were people who were working around me. And they approached me, they wanted to join me as a team. I remember one of the person who's still with me, and I'm very proud about that. She wanted to work with me, but I didn't have the resource to employ her at that time. And at that time I was working solo, just myself. And I was taking help of other people in the clinic that I was working. I refused this person that I cannot have you. 2 days later she comes back again. She says, doctor, anything that you want me to do, I can do in the clinic, you know. I said, I can't afford you. She went away. A week later, she comes back again, asking for the same thing. And I looked at her, I said, okay, I'll give it a try. First thing I told her, we need to groom you. So I did a little bit of grooming for her. I did training for her. It took me about few weeks. She started taking a lot of interest, and the most important thing was she was eager to learn, and she would learn a lot.
She was motivated.
She was very motivated. And I thought, this is the person who I can
cultivate,
exactly. And I started training and teaching her. She became very good at it. She used to assist me in surgery. She used to do lasers for me. She used to skin treatments. And 15 years later, she's one of my best therapists that I have today. And I know that she does exactly what I like to do.
So I think recruiting motivated people is important, because no matter if they're not motivated, no matter how much you teach them, they're still not going to learn.
Yeah. During this process, yes, of course, I have fired a lot of people, you know, and I've realized anybody whose focus is money is not the person that I want to hire.
Wow. Because firing people is not an easy thing to do.
It's not an easy thing to do. But I'm very bad at it. You know, if I don't like it, I just fire them. And I tell them the reason.
You're good at it, but you don't like doing it. But it has to be done.
It has to be done.
You have a team of over 100 people now working for you. Do you still get involved in recruitment yourself?
Yes, I do get involved in recruitment, though I have a team which does that. But many times for special staff like my nurses or my coordinators who directly deal with my patient or doctors, I'd like to meet them before they start their work. And I tell them what I like and what I don't like. and I tell them about the ethics of the practice, and I tell them about if you can work with a big team, only then this is the right place for you. But if you are a solo person, if you are an I, me, myself person, then you can't be a fit in this team.
Next 3 years, doctor, what's in store for you?
I think still I have a lot to achieve. Obviously from the business front, I want to expand. And at this point of time, I am discussing in Beverly Hills, and I want to be in Beverly Hills, Los Angeles. So I'm hoping I will have something there in next year or so. But there's a lot of expansion plan in the Middle East as well. I'm just looking for right partners because I know I can't do it alone. So I need a bigger team, to expand. So that's going to happen.
You said when you came here, you had little money, you opened up a clinic with a partner, and it went wrong. Okay, so you lost everything you had. What kept you going? What lessons did you learn from that?
When I partnered with the person, I had a huge respect for that person. He was my mentor, he was my teacher. So I had a blind faith in him. I invested blindly with certain expectations. Unfortunately, it didn't turn out to be what I expected. So what I realized is it's not easy to partner with anybody because everybody has their own expectations. Unfortunately, there's no win-win. There's always a winner and a little bit of loser. And I didn't wanted to be a loser. So I decided I have to do it all by myself. So I literally started over again. But obviously my partner was my wife, and I knew that a person that you can trust most is your own family, who probably will not have personal interest in them, but the interest of the family. I tried partnership with other people as well. It didn't work out because everybody didn't have that same idealism that I had of working in ethics within legal framework. Obviously, people wanted to have shortcuts. People wanted to employ things that were not suitable to my beliefs, and we had to break out. So I had few partnership failures. And then I realized that it's not easy to have partners, but I'm still looking for good partners.
Through experience, you got your green flags and the red flags with partners
Absolutely.
as well.
Yeah.
So you asked certain questions that have failed you in the past. From your experience, you asked the right question. Well, I wish you all the best, doctor, and thank you so much for your time. Really, really enjoyed it. Although I've known you for like 11 years, I've learned so much from you today.
Thank you very much.
Thank you.
It's a great learning experience for me as well.
Much
thank you.
Doctor. Thank you. Did you start working in a hospital or a clinic for somebody else and then realize that you could actually set up your own business?
Yes, first I was employed by a practitioner who I worked with, and it was in Bahrain. So it was a great experience. And of course, I was more science driven then, but I also got an exposure of how they are communicating with the clients, how they are acquiring clients or the patients, how they are spreading the network.
And I guess how you could improve things as well.
Absolutely. So I kept all my medical books aside and I started reading about business. I started reading about networking, started reading about HR, about marketing. So that was a whole new exposure.